Hello friends, as Jock Tellman says, each body is different, therefore each rehabilitation must be different. Hello and welcome to my episode on why neurophysiotherapy is important. I am Simran Narang, health, weight loss and a lifestyle coach, co-founder of the Life Experts, master coach with the Academy for Coaches, and I'm a certified in integrative nutrition and lifestyle under the mentorship of Luke Coutinho. I warmly welcome Dr. Amruta Ekbote, MPT in Neurophysiotherapy, Assistant Professor in Sancheti Institute, College of Physiotherapy, Pune. Sancheti Orthopedic Hospital, Pune is a renowned hospital credited the number 2 best orthopedic hospital in India. Welcome, Dr. Amruta.
Thank you.
So let's start right away, Dr. Amruta. So in what conditions is neurophysiotherapy used?
First of all, I would like to thank you for having me here. It is a great pleasure to be here talking with you. So neurophysiotherapy is a type of physiotherapy that it is a specialization, you can say. There are various conditions in which neurophysiotherapy can be useful. So basically, we deal with injuries that affect the brain and the spinal cord, as well as your entire nervous system, basically. So it consists of everything: your brain, spinal cord, nerves. Okay, any type of nerve injury, neurophysiotherapy can be useful. Okay, other conditions like stroke, which you also call paralysis, right? So in stroke specifically, neurophysiotherapy is useful. In spinal cord injury, it can be useful. Then even after brain surgeries, like conditions in which the brain is affected with tumors, after tumor removal or any other neurosurgery, if the person has underwent. After that, neurophysiotherapy is the way to go.
Oh, I see. Mm-hmm. So is neurophysiotherapy treatment different from the traditional physiotherapy that a person undergoes?
Not entirely different per se, but I would like to tell you that it is a little bit different because the techniques that we use are different than what traditional physiotherapy has. So in neurophysiotherapy, we basically focus on the functionality of the patient. So what do you mean by functionality? So is the patient able to sit up? Is the patient able to stand up? Is the patient able to walk? Right, traditional physiotherapy or musculoskeletal physiotherapy that we call, it mostly deals with the muscles in joints and the pain that is and the pain related to it. So traditional physiotherapy helps in alleviating the pain of the joints and muscles, whereas neurophysiotherapy, it is most commonly and mostly related to functionality of the patient. So it is not entirely different, but a little bit different, yes. The techniques that we use, they are different than traditional physiotherapy.
Slightly different, you know.
Yeah, slightly different.
Okay. So is this physiotherapy for lifelong, or the physiotherapy for joints is to be done for a month or so and then, the patient is left on its own to do it. So how is this treatment?
Okay. So in neuro conditions, so basically there is a window period. Window period is the period from the injury to a certain amount of time, right? In this window period, maximum improvement occurs. That is why we call it the window period. So once the improvement has occurred, the patient is put on a maintenance program. So neurophysiotherapy in this window period is very crucial because maximum improvement is going to occur in this period itself. Afterwards, the patient goes into a plateau. Improvement does occur in that plateau period, but not as fast or as effective as the window period. So the therapy that we do is very crucial in this window period. After that, we can put the patient on a maintenance program. So this maintenance program can consist of home exercises or supervised exercises. Some set of exercises we give to the patient. We make sure that it is a little easier for the patient to understand, so that the patient can do it on his own. If not, we can teach the relative also, or we can take a supervised session.
Okay, so you mean to say in this maintenance mode, like once you teach the patient, so the patient will be able to do the physiotherapy on his or her own?
Yeah, not entirely, of course,
Mhm.
but certain set of exercises the patient absolutely can do on his own. Certain set of exercises we can teach the relative, so that the relative helps the patient recover, or motivates the patient to do the exercises that we have taught him. Also during COVID, when everything was shut down, so there is a new concept called tele rehabilitation that has come into picture. So it is very popular nowadays because of COVID. There was all social distancing, and the therapists were not going to the patient's house because more risk of COVID, right? More risk of
Right.
infection.
Mhm.
So we can put the patient on a tele rehabilitation protocol as well, so that the patient undergoes supervision. Also, the therapist knows what the patient is doing, if he is doing it right or not. Also, the relative can consult the therapist right away, that maybe lack of motivation, or maybe the patient needs counseling. So everything can be done in that phase. So the tele rehabilitation protocol is really useful.
Oh, tele-rehabilitation. That's a good term. That's a new term, I
That's
think,
the way.
what we are hearing.
Yeah.
Right. So, what is the most common treatment like for neurological conditions, basically?
So neurological conditions, there is no common treatment as such, because the even though the condition is the same, every impairment is different, every person is different, every part affected is different. The brain is a very mysterious organ, right? It has so many functions, and every part of the brain has a different function. So every part treated or every part affected will have a different treatment. Also, it affects the person as a whole. It is not just localized to a certain area, a certain part of the body. So since it affects the individual as a whole, each person is different, so the treatment is according to the individual. It is individualized. There is no common treatment in neurology. You cannot compare two patients with the same condition to have you cannot expect two persons with the same condition to have the same treatment. It is always going to be different.
Okay. Mm-hmm. Something nice, good, very, very good information, right?
Thank you.
Doctor, I would also like to know, do kids also benefit from this type of physiotherapy, like, and under what conditions, basically?
Yeah. Kids, yes, definitely we do treat some pediatric conditions, wherein the most common you might have heard is cerebral palsy. So what happens in cerebral palsy is that the kid's brain is affected during birth or during the pregnancy, and it hinders the growth of the child as a whole. So it is not just the physical growth that is affected, but his cognitive growth, his mental growth, his emotional growth, everything is affected. So this condition specifically is benefited from therapy. So here in this condition, neurophysiotherapy is a very long process, because the child comes to you as a baby, and you have to treat the child until and unless he is functionally independent. So it might take 3 years, it might take 5 years, it might the patient or the baby might come to you up till his teen years also. Other conditions that can be treated with physiotherapy is ADHD, that is deficit hyperactivity disorder. Then what do you call this, Down syndrome. It is a genetic condition. So even in that condition, the child has a little developmental delay. So physiotherapy can help in fast, not you cannot say expediting the process, but yeah, physiotherapy definitely helps to regain the milestones that the child has not achieved. Also, there is another condition called Duchenne's muscular dystrophy. It is not a very uncommon condition.
Mm-hmm.
You can see we do see patients with DMD a lot, and there are other very rare conditions that also can be treated.
Okay. So I'm sure, like I think we must have a separate session where, we deal with kids, because I too deal with like patients who have ADHD. So I think, this is going to be really informative, where we will deal with kids, in a separate session with you.
Yeah, absolutely. I'll be really glad to give you more information on pediatric conditions.
Thank you so much. Thank you very much, Dr. Amruta, for sharing this information. I'm sure, like, many will benefit and their doubts will be cleared, because I don't think many are aware of, what neurophysiotherapy actually is. So it's really going to benefit a lot of people. And thank you so much for being with us.
Thank you. Thank you so much.
Thank you. I am sure through this valuable conversation with Dr. Amruta Ekbote has cleared many doubts on the importance of neurophysiotherapy and under what conditions it benefits the most. In case you have any further doubts or need any more information, please feel free to either put your questions in the comments below or DM me. I will ensure to take it up in the future episodes. Before I close, a disclaimer. This video is for information purposes only. Please check with your doctor, your trainer, your physiotherapist, and a certified coach before you decide on any further action. If you have liked this video, please share it with your family and friends. You never know who it might just help. Until the next time, stay safe, stay healthy, and yes, don't lead a sedentary lifestyle.